all, welcome, and I'm Dr. Avnita. I'm reading the Usmle Step 1 First Aid textbook, and we are going to continue with the endocrine system. So, this is the anatomy part of it. If you want the embryology part of it, it's the video just before this one. You can also follow me on the Spotify podcast. It's called Usmle for Dummies by Dummy, and you can find me on TikTok and YouTube. Anyways, so endocrine anatomy. So pituitary gland, this has anterior pituitary and posterior pituitary. And anterior pituitary, which is called the adenohypophysis, this secretes the FSH, LH, ACTH, TSH, prolactin, growth hormone, and beta endorphins. Melanotropin, MSH, secreted from the intermediate lobe of pituitary. So this is derived from the oral ectoderm, which is also called the Rathke's pouch. Alpha subunit, hormone subunit, common to TSH, LH, FSH, and HCG. Beta subunit determines hormone specificity. So pro-opio melanocortin derivatives, this is beta endorphins, ACTH, and MSH. So pro-opio melanocortin derivatives, these are three of those. These are beta endorphins, ACTH, and MSH. So we talked about all these hormones. So anterior pituitary is LH, FSH, ACTH, TSH, prolactin, growth hormone, beta endorphins, and then we say there is melanotropin that is secreted from the intermediate lobe of the pituitary gland, and then we're coming here on the side that says pro-opiomelanocortin derivatives. This is the now these derivatives are beta endorphins, ACTH, and MSH, and you can remember it with the mnemonic GoPro with BAM. So GoPro, that is the pro-opiomelanocortin derivatives, BAM, BAM. So beta endorphins, A for ACTH, and M for MSH. MSH is the melanotropins, which is released from the intermediate lobe of pituitary. Then derived from oral ectoderm, that is the Rathke's pouch. So this anterior pituitary is derived from the oral ectoderm, the Rathke's pouch. Then the alpha subunit hormones, subunit common to the TSH, LH, FSH, and HCG. And then the beta subunit, it determines the hormone specificity. The other mnemonics that you can use is flat peg, which is the F is for FSH, L for LH, ACTH, then TSH, peg, P for prolactin, G for growth hormone, then B flat. Basophils, these are so basophils and then acidophils. So basophils are FSH, LH, ACTH, and TSH, and acidophils are acid pig, which is prolactins and growth hormones. And then posterior pituitary, this is neurohypophysis. This stores and releases vasopressin, antidiuretic hormone or ADH, and oxytocin, both made in hypothalamus. This is at the supraoptic and paraventricular nuclei and transported to posterior pituitary by neurophycins, which is a carrier protein derived from neuroectoderm. So we talked about anterior pituitary, now we're talking about posterior pituitary. Anterior pituitary, we say that it secretes FSH, LH, ACTH, TSH, prolactin, beta endorphins, growth hormones, melanotropins. Melanotropins are coming in from the intermediate lobe of the pituitary. Then we said that this is derived from the Rathke's pouch, which is the oral ectoderm. Then alpha ones, alpha subunit, FSH, LH, TSH, and HCG. Beta is the specificity of the hormones. Then GoPro with BAM, which is the pro-opiomelanocortin derivatives, which is BAM, BAM, beta endorphins, A for ACTH, M for MSH. Then flat peg, which is the FSH, LH, ACTH, then TSH, and PEG is prolactin and growth hormone. Then B flat, this is the basophils, which is FSH, LH, ACTH, TSH, and acidophils is the acid pig, which is prolactin and growth hormone. Then we're talking about now posterior pituitary, which is neurohypophysis. This is only two hormones, which is the ADH and oxytocin. And ADH and oxytocins both are made in the hypothalamus, and then they are where in hypothalamus. This is kind of important because I usually see these questions in the question banks for boards of where it is made. So this is made at the supraoptic and paraventricular nuclei, and then it is transported to the posterior pituitary via the neurophysin. So that means that these hormones, they are stored and released there. They're not made there. They're made in the at the supraoptic and paraventricular nuclei of the hypothalamus, then transported to the posterior pituitary via the neurophysin, which is the carrier protein derived from the neuroectoderm. Then we're talking about the adrenal cortex and medulla. So the adrenal gland in itself is at the superior surface of the kidney. We are looking at this picture right now, so you can see this is at the superior surface of the kidney, and then it has like these layers of the medulla, and then the cortex, and then there's the capsule. So now let's talk about the histology part of it. Histology says that it is divided into cortex and medulla. So the cortex is divided into three things: GFR, zona glomerulosa, zona fasciculata, and zona reticularis. And now, even before we go to the other words and all, let's look at this little mnemonic that's right at the bottom of the picture, which says GFR responds with salt, sugar, and sex. So GFR responds with salt, sugar, and sex, which means that now we are going to relate GFR letters to these three things: salt, sugar, and sex. So glomerulosa, G, salt. Salt, mineralocorticoid. It's regulated by angiotensin 2, releases mineralocorticoid, which is the aldosterone. Fasciculata, zona fasciculata. This is in the ACTH-CRH, regulated by ACTH-CRH. Hormone class is glucocorticoid, and it releases cortisol. Then reticularis, this is regulated by ACTH-CRH, and hormone class is androgens, and hormone produces DHEA. So salt, sugar, and sex. Salt is the mineralocorticoid, releases aldosterone. Sugar is glucocorticoid, releases cortisol. We know that corticoids itself, steroids, they are increasing your sugar, so known to increase your sugar. So salt, sugar, and sex is the androgen, so DHEA. That's the cortex part of it. Cortex part is again derived from the mesoderm. Medulla is derived from the neural crest. Medulla has the chromaffin cells. These are preganglionic sympathetic fibers. They are regulated by the preganglionic sympathetic fibers, and hormone class is catecholamines, and they release epinephrine and norepinephrine. So that is the adrenal cortex. I hope this makes sense. GFR, G for salt, F for sugar, R for sex. Salt is adrenal mineralocorticoids, that's the aldosterone. Sugar is glucocorticoids, that's cortisol. And sex is androgens, that's DHEA. Then that's the cortex. Medulla is the chromaffin cells, epinephrine, norepinephrine. Then the endocrine pancreas cell types. These are three cell types. Islet of Langerhans is a collection of beta, alpha, beta, and delta endocrine cells. The islets arise from the pancreatic bud, and alpha is for glucagon, that is in the periphery. Then beta is the insulin, that is the central, and then the delta is the somatostatin, that is interspersed all throughout it. So island of Langerhans, collection of alpha, beta, and delta endocrine cells. So these are the three types of cells in the pancreas. So endocrine pancreas cell type, islet of Langerhans, collection of alpha, beta, and delta endocrine cells. These are arising from pancreatic bud. Alpha is for glucagon, beta is for insulin, and then somatostatin is delta. And alpha glucagon is on the peripheral side, beta insulin is in the central side, and then somatostatin delta is just spread around. And you can see a little picture on the corner that actually shows alpha, beta, and delta. So alpha is for glucagon, beta is for insulin, and delta is for the somatostatin, that is just all over the place. And I think that is it. That is all for the anatomy section. Next is the physiology section, and we'll read that tomorrow. Okay, thank you, bye.